We are now recording. So we are in Module 2 for Week 6 for Maternity Assessment Part 2. We are going to start with a Q&A. Do we have any questions in reviewing the previous week's content or this week's content?
I have a quick question. I was studying about using the outline for the exam, and on it has the difference between dysarrhythmias and missing your period altogether and just having pain with your period. Did you want us to know the details as far as primary and secondary, or just what they like technically are?
What they are, recognizing the and applying the definition, basically.
Mm-hmm. And for miscarriage, I was looking for the information for that. Is that combined into chapter 5, or where would I find that?
I think that's part of 4 and 5.
Okay, gotcha. And my last question for hormonal regulation, did you just want us to know like the cycles and like when does like estrogen peak and when is the different phases and stuff of the menstrual cycle?
Not to that detail, just the overall what hormones are required, and therefore if it's insufficient, you may lead to infertility.
Okay, gotcha. Well, that was it. Thank you.
Thank you. Any other ones? The video on miscarriage was super short. Is that what we are going by? You should be able to find most of that in that video, yeah.
Miss Gilbert.
Mm-hmm.
Come on now. On the doing the due date, the expected due date, I kind of found the way that we was doing it. I don't want to say it wrong, but the way I did it at ATI, we was kind of off a month.
It was what off?
Like a month, we was off. Like when we was doing the exercise last week, and I know I kept counting it up, but the way I'm counting it up is the way ATI counted it up too. Like I'm going 3 months back, or I'm counting 3 months forward. Not counting that same month, and I'm getting that date.
ATI counted the month or didn't count the month?
They didn't count the first month. They went to the next month and counted 9 months.
They went up 9 months. What chapter is it? I was wondering.
I was.
And I can review it and make sure.
Right. It's in the maternal newborn, and it's chapter 3.
Chapter 3. Okay.
Yes. You will actually see it in the application exercise, the number 1 on page 19.
The way that it says it in
Yeah,
18,
so they're including that month.
yeah, that was the same way they did it in the exercise you had us do too. So I thought that was the way to do it, but I don't know.
I'll have to verify, make sure, because they're doing it without the month. And I was going off of memory that you did it with the month. So let me verify before I say anything, and I'll make an announcement, okay? Afterwards.
Okay.
All of your resources don't count the month, so it might be just me. I was going off of my memory. I might be wrong. I'll verify. Right. Any other questions? Things I need to verify?
In the expected findings during pregnancy, when it's breaking down by the trimesters and it has like the different things that we should know as far as like the sequence, that do you want us to know that for the exam as well, or just generally what is expected findings? Not
The first and the third trimester that I did in the live session do have a particular order that they present in. Whose microphone is that? Ooh, it's reverberating me for some reason. Whose microphone? Okay, it's off now. So in the live session that I did for the progression of pregnancy and expected findings, you make sure you understand those terms so you can know what, a Gödel sound, Gödels and lightning, surge, all those things mean. But also the ones that do have that arrow that are straight in that line, do recognize that those are in that specific order. So like first trimester and third trimester, make sure you know those orders. And your first sign and then the progression of pregnancy.
Okay, Miss, I have one more question. On the stages of labor, on your PowerPoint, is different from the stages of labor that is in ATI also. Like I think at birth, I think at the second stage, I think that's birth, but it's saying something else. Like it's like a stage behind.
Okay. You just need to know that in general, the first stage of labor is when they're dilating.
Right.
And the second stage gets to the birth. So birth happens. And then third stage, that you have everything delivered.
Okay, so we're gonna
The
go by your
fourth stage is
PowerPoint.
postpartum. Just the general progression of how labor happens and then recognizing concerns.
Okay, because yeah,
The expected presentation of the fetus. So which way are they supposed to come out?
Okay.
When do they have fontanelles? Kind of thing. Just the general overview. There's a lot of patho anatomy that Ms. Winsett has in her video. But just get the big picture of it, the general progression. I wouldn't focus too much on identifying what stage based on a situation, if that's what you're wondering.
Okay.
Just recognize that if it says that she's in the second stage of labor, that you kind of know where she's at. She's not like in postpartum, so that you can apply the question.
Okay.
Just so you understand the terminology.
Gotcha.
Okay. Any other questions? Dropping pins over here. No more questions?
I have some more, but I'll wait until our meeting at 2. So
Okay.
it's fine.
That's okay. All right. So we're gonna go through this labor and delivery game. So it's that maternity series. Excuse me. And yeah. So I'm gonna try and view the chat. I want to make it bigger so I can see everyone's responses. So I'm gonna kind of drive it, but y'all are gonna answer it and tell me what to click. So it's kind of applying everything that hopefully you've reviewed. You see my screen? Mhm. All right, you are the nurse working in the labor and delivery unit. Rachel Spencer has just arrived and you're assigned to assess her. You were told she is here alone, but her husband Patrick is on the way. The antenatal record shows she is negative for strep B and she has no significant past medical issues that would affect her labor and delivery.
Hi, Miss Spencer. My name is Ian Cameron, and I'm Hi, I'm Rachel. And the urine sample I was asked to give, it's just on the table. Okay, thanks. So, what brought you in for an assessment? I'm in labor. And why do you say you're in labor? I'm having contractions. I just had another. Okay. And when's your due date? It's in 3 weeks, March 10th. All right. And what pregnancy is this? This is my second pregnancy. Great. Can you tell me about your last birth? Yeah, I had a vaginal birth about a week overdue, but my baby was healthy. Terrific. And who is the healthcare provider taking care of you for this birth? It's Dr. Kapansky. Dr. Kapansky's on call and presently in the OR. I'll notify her that you're here. Now, do you have a birth plan? I do. It's on my phone. Okay, we'll discuss it later. Now, I've reviewed your antenatal chart and noted that all your blood work was completed, and besides your hemoglobin being slightly low, there was no other abnormal blood work. Is this correct? Yeah. Great. Okay, we'll also do blood work here at the hospital. Now, have you had any vaginal discharge? Well, I've had.
It's breaking up. I'm sorry. So far, she has discussed that she has 2 pregnancies. This is her second one. Is there a way to put on subtitles?
Game options.
Game options. Look at that.
Pasta, jelly-like, and pinkish discharge.
I can't see where I can restart the video. So far, this is her second hearing Darth Vader. I'm sorry. Second pregnancy, her first one was slightly post-term by a week, but was healthy, living baby. She had a slightly low hemoglobin. She's strep B negative. I don't know. It comes around off weird on different people's internet sometimes. Audio. What else? Did I miss something? That's all I can remember right now. Oh, she has her birth plan on her phone. Her husband's on the way. I think that's about it. All right, let's see if these subtitles work.
Charge about 2 hours ago, but my water hasn't broken yet. Okay. And are you feeling any rectal pressure? No. And how often are your contractions? I'm having some contractions. I feel like this baby's gonna come soon. You know, my last baby came so fast, so I was advised to come to the hospital as soon as contractions started. So I dropped my daughter off at my mom's and I got her as fast as I could.
All right. So how should you respond to Rachel's expectation of an immediate delivery? Assess further, indicate true labor, or treat as potentially false labor? Assess, let's see.
Are your contractions regular? Yes, I've been having them about every 5 minutes. Okay. Let's see where you're at. I'll begin by assessing you, and then we'll have a better idea of the progress in your labor. Okay. Do you want me to remove my stockings? My ankles have been swollen the last few weeks, so I was advised to wear the stockings. Yes, please remove your compression stockings. And when you're done, you can lie down.
tied to.
Great. Okay, I'm just gonna bring the blanket here. Are you comfortable?
Are you kidding? I would assume he wants her to remove her stocking so that he can assess how much edema is going on currently. Whereas with the compression stockings, it would include his assessment.
And if you can raise your heel above your belly. And we are gonna check your heel heart rate and your vitals. But first, we're gonna feel to determine the position of the baby. Okay? I'm gonna be touching you. But first, I'm gonna warm up my hands. Okay. I can feel the bone.
The bum. So, is the baby in the right position if the bum is on top? Good.
I can feel the back on the right side. And I can feel the hands and the feet on this side. And the baby's head is down.
Right.
And the baby's head is engaged.
All right. So, with the baby being in this position, in what area of the abdomen should you assess for fetal heart rate? Yeah, she's way too cold. She's due in 3 weeks, but she started having contractions. You want to say right lower? No, you don't need to know this for the exam.
Okay. I'm just going to get the Doppler. Miss Jelly might be quick on it, okay?
You don't need to know this position for Doppler, but there are other things in this video that you might need to know.
All right, can I just have your wrist? So, baby's heart rate is at 130s, which is within the normal range. Did you want a tissue to wipe yourself off? Now, did you want me to put the bed up so you're more comfortable? Sure. There, how's that? All right. We're going to take your vitals now.
So it is important to know how to find it though in general. Like Miss Love is talking about with the NCLEX. So wherever the baby's back is, so that's why you need to know what position the baby's in first. So usually they're curled over, so you're not going to be able to assess the front of them. They're going to have all this in their arms. You can't see me, I just realized with my camera. So you have to assess their heart rate through their back. So through the fluid, through the baby mama and everything else. Okay. So wherever the baby's back is where you're looking for it. And I think someone said it in the chat. Yes, and he should sanitize that Doppler afterwards.
Just have you extend your arm. Is that comfortable?
I know, right?
I'm just going to take your temperature.
She has it on her elbow. I thought the same thing.
I'm just gonna put this in your ear.
Mm.
Your temperature is 36.7, which is within the normal range. Okay, so your respiration rate is 22, and your pulse rate is 94. Okay, what's my blood pressure? Your blood pressure is 144/90. That sounds really high for me.
How should you respond to Rachel's higher blood pressure? This is a normal finding in labor, retake in 15 minutes, or assess for edema. I want to go with normal. Retake. Edema. Assess. Retake. I'm seeing more for retake than the other options. I'm going to start with retake. Let's see what happens.
I'll retake your blood pressure in 5 to 15 minutes and we'll see how it is. Oh, so you just redo it? But my blood pressure is really high. Is something wrong? I've never had high blood pressure before. Is the baby gonna be okay?
Oh, now she has anxiety. So how should we respond with her anxiety? Discuss the reason for stress, encourage relaxation, or recommend breathing techniques. Let's see. One for relax. Discuss. 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 All right, we're going to do discuss.
The baby's heartbeat is good. Your chart indicated that you do not have a history of high blood pressure. From your prenatal record, there hasn't been any protein in your urine. Let's check again. Dip is showing trace of protein, which is normal for a pregnant woman when she loses her mucus blood. Now, sometimes women come in and they're anxious and their blood pressure goes up. How are you feeling? Well, I'm a wreck. I've texted and called my husband 10 times, and he's on his way, but he should have been here by now. I got one message that traffic was bad, but he should have been here. Oh, he's here. He's just finding parking, and he'll be right up. Oh, that's great to hear. Oh, I feel so much better that he's here. Oh, I think I feel the contraction starting. Oh, yes. That contraction is quite strong. They're getting stronger and lasting longer. Well, there's lots of strategies that we can try to help that.
Okay, so first, Jamie posed a question wanting more information about the false negative on the edema. Her stockings were just removed, so it's going to take a little time for that edema to come back. So if he assesses for edema right now, there might not be much. So because the compression stockings pushed it away, yeah, displaced the fluid. Any other questions before we move on?
Jamie had a question about what the contraction feels like from palpation.
It's muscle. So it would be hard, firm, like flexing a muscle. Yeah, flexed. Yeah, so then in between the contractions, the abdomen, the uterus would not be contracting. So it's not flexed, so it would be more easier to palpate and maneuver. Okay. What should you suggest to manage Rachel's labor pains? Breathing techniques, walking, or medications? Oh, that's a good point, Beverly. What does her plan say? All right, there's more for breathing. There's a few for the others. We're gonna go with breathing.
I noticed that during the contraction you held your breath. Instead, try to breathe slowly during the contraction, and it may help to focus on an object. Patrick! Hi. Peter, so happy to be here. Traffic's wild. Good man.
Also, since we don't know her birth plan, going from least invasive to more invasive would be another way to figure out that question. So it might be first, but we don't know if she's going to do pain medicine, so we can't jump to that conclusion. She might have gotten upset at us if she didn't want it.
Yes, I'm so glad I was getting somewhere. Great talking. I'm Ian Cameron, your wife's nurse, and we were just talking about breathing through contractions and the importance of trying to breathe slowly during the contraction and focus on an object. Is visualization a part of your birth plan? Yes. Have you chosen or brought with you an object to focus on? I don't know. Oh, remember, honey, you're going to focus on the baby's ultrasound picture? Do you still have that in your purse? Oh, yes. Yeah, that's a great idea. Now, also look a little more relaxed, so let's take your blood pressure again.
And pain meds can slow their labor progression. So pain medicines is usually at the very end.
So your blood pressure is 106/71, and your pulse rate is 85, which is completely within the normal range. I'm just going to take this off you. It's good to see you looking more relaxed. I feel the contraction starting. Oh, okay, honey, just breathe deeply and then focus on the picture. So your contractions are about 3 minutes apart, and this one lasted 45 seconds. Oh, I felt a gush. Okay, let's take a look. And it looks like the fluid is clear.
So, in Meredith's point that she said it's not always the case that it can speed up labor. If the pain medicine is helping to relax you, it could progress and allow it to happen more naturally. Whereas if you are in pain and you're tight and you're holding everything in, you're not allowing the contraction to really move and do its job. So that is the other end of it. Yeah. She's gonna feed him that picture. Okay. All right, so what is your priority nursing action following the rupture of Rachel's membranes? Vaginal exam, reassure her, or assess the fetal heart rate? Okay, we're going with assessing.
Okay, I'm going to take your baby's heart rate again. You just raise your gown.
Change the sheet.
That's great. So, your baby's heart rate is in the 130s, which is within the normal range. And your water broke at 08:45 a.m. And now I'm just going to check your cervix if that's okay. Yes, so I feel a contraction starting. Oh, okay, just breathe deep.
When should you complete a cervical assessment? Immediately when pain starts to ease or after the contraction? After the contraction, looks like where we're going. Also, side note, since her membranes have ruptured, we're probably going to be very mindful every time we do a cervical assessment, right? We don't want to introduce infection not only into her, but then up to the baby because that membrane is no longer there. So we're extra careful. Okay.
They're getting stronger and lasting longer. Yes, that last one lasted 60 seconds. Well, now that your contraction is over, I'd like to assess your cervix to see how far dilated you are and the baby's position. Is that okay? Yeah. Okay, I'm going to put the bed down. And if you can just put your ankles together and just let your legs move apart.
So yeah, we're gonna keep wanting to assess and make sure that progression of labor is happening in that it's progressing. So they most likely will use sterile gloves after this point once the membranes have ruptured, just to help reduce that infection. I don't know if he's going to put it on. I haven't watched this one this far, but I would definitely recommend at this point that they would most likely use sterile gloves. Also, we're going to make sure that the labor is progressing. So we do need to check to make sure that she is dilating and that there is effacement occurring. If she continues to have contractions and nothing is opening, we might need to go to a C-section. So need to keep an eye on it, but we're not going to overly assess. One, it's annoying. You don't want that as the patient. And two, you're introducing potential for infection every time you do it, right? Yes, and the nurse would do these assessments. These nurses are trained in it. Oh, he is going to use a sterile package. that we're gonna ignore that's already opened. We're ignoring that. The world of sim. He's putting on sterile gloves. One glove, looks like.
Okay. I'm gonna try to feel it. Not sure. Okay.
What is that?
Or 6 to 7 centimeters dilated. Your cervix is thinned out. Your baby's head is down. And the baby is nice and low. Does that mean that everything's fine and I'm getting close? You're progressing nicely. Okay. Now I'm gonna take that little pad out from underneath you. Wet one. That.
Wash your hands.
Just look at your face. I'm starting to feel uncomfortable laying like this. My back is hurting a bit. Okay. I'm just gonna put the bed up for you. Patrick, could you pass me that pillow over there? Instead of handing it to me, you just put it under Rachel's right here. Okay, just a little more there. That's great, thank you. That feels better. This pillow you put under my back to make me feel more comfortable.
Why did we put Rachel in this position? Improve contractions, relieve bladder, or prevent hypotension? Most of y'all are saying prevent hypotension.
The pillow under your right hip is to prevent pressure from your uterus on one of the large vessels called the vena cava. This can cause you to have low blood pressure. Putting your head up allows for gravity or pressure to be exerted, which helps your baby to come out. Oh, my back is really starting to hurt. Oh, I know how to help. No, stop. That feels awful. Don't touch me. Why? It worked for our first child. I don't know. All of a sudden, I just don't feel like being touched. Don't touch me.
What should you suggest Patrick do next? Stop, apply firmer pressure, or provide a heating pad? Sue says, run. All right, stop.
Sometimes during labor, women experience something called hyperesthesia, which is a sensitivity to touch. It can come and go. Oh, well, I guess that explains it now. Oh, I'm starting. Oh.
Yeah, hold on. Okay, so when you have a large baby, which is usually by the 3rd trimester, sometimes it can actually start in the 2nd trimester. When the uterus is so large and it has the baby in it, the weight of all of that gravity when the patient is lying on their back presses on their superior vena cava and decreases cardiac output, decreases the mother's blood pressure. And so then that can actually lead to decreased blood flow to the baby. So putting them on their side prevents that pressure on the vena cava. I actually had this multiple times. I was no longer allowed to lay on my back during my 3rd trimester. It would actually cause decels in Lily because of the decreased blood pressure.
What's your interaction so far? Do you have any questions about what your baby is for? I really just want to see this baby. Get to hold my baby right away. You know, when our first baby was born, the doctor and nurse took her for what seemed like a really long time. We just wanted to hold her baby. So for this birth, in our birth plan, we decided to practice skin to skin.
When will skin to skin be initiated? After Apgar, after the umbilical cord is cut, or after birth? After birth.
Put your baby on your chest as we try the baby doll. We can do the Apgar assessment and cut the umbilical cord during the skin to skin time. Generally, skin to skin is practiced for about 1 hour and up to 2 hours. We want to practice skin to skin this time because it very helps to establish breastfeeding. Oh, you're absolutely right. It helps the baby latch when starting to breastfeed. Overall, it enhances the bonding with your baby. Also, skin to skin helps stabilize your baby's vital signs, maintains body temperature even better than in an incubator, and your baby is less likely to cry. There's a lot of benefits.
20 minutes later.
Okay, so the lab work is done, and Dr. Kapansky is good to see you, and everything looks great. You're progressing nicely. Now, I've reviewed the birth plan with you. And now what I'd like to do is check the field heart rate, okay? Can I have you raise your gown? What about the baby? You know, the baby's heart rate goes up and down, seems to fluctuate. That's very common at this time. The baby's heart rate is between 130 and 145, which is completely normal. You know, during the delivery of our first baby, my wife wore a monitor on her belly. Well, maybe doing the same thing this time.
What type of monitoring is required for Rachel? External fetal monitor, intermittent auscultation, or the internal fetal monitor? Haley, you beat us to it. I have 3 for external and 2 for internal. Or external. We're gonna go with external.
We'll put an external fetal monitor on your wife since it's required for all pregnant women who are in active labor. I'll be back shortly with the monitor.
Yeah, so she could have an internal monitor now that her membranes have been broken, but least invasive would be external. There's not really a need. Everything is progressing fine. There's no fetal distress. So an external should be enough. Internal monitoring is only done if there's problems or complications. You can't get a good reading on the external, things like that. And because it also introduces that risk for infection, trauma, things like that. He did say the fetal heart rate was fluctuating, but he did tell Patrick that that was normal at this stage. The baby's heart rate is going to be practicing as well as the mommy's body is practicing for labor. how I think of it. Yeah, usually it's done earlier. Put a monitor on earlier. Internal is rarely used. It's only for complications that you can't get a monitor on the baby. If she has an epidural, it would still be fine for an external because it's just going to lay on top of her belly and strap to her belly. It didn't want the external one though. I don't like the
Put an
internal.
internal fetal monitor in so that we can monitor your baby's heart rate continuously. What do you mean continuously? We insert a small electrode on your baby's head and attach it to a transducer. Then, even if you move around, we can monitor your baby's heart rate. That wasn't part of our birth plan.
Mhm. Yeah.
In active labor, the fetal heart rate is monitored every 15 to 30 minutes or more if needed for at least a minute at a time. Now, there's no need at this point to continuously monitor your baby's heart rate. And if we observe any significant changes in the baby's heart rate at all, the external fetal monitor. Starting.
Come on, Patrick.
Okay.
No picture of the
Now
time.
that the contraction's over, we'll see if you're ready to push, okay? I'm gonna put the bed down. Patrick, can you help by looking that pillow up? I'll just get you to put your ankles together. Thanks.
Yeah, so things can, even though everything looks fine, progressing, most hospitals, evidence-based practice would probably put them on a continuous monitor because things can happen so fast. Things can go wrong in an instant. So having that continuous monitor is always going to be better. Yeah.
Am I? Just got to touch you. Hold on. 8 centimeters dilated. And your cervix is fully effaced.
We suggest during the next contraction, moaning, panting, grunting. So she's starting to progress. She's a little bit further dilated and she's fully effaced now. Panting seems to be the majority.
Okay, I'm just gonna put the bed back for you. Can you grab that pillow? Just put it under. Okay, please. Great. Now I understand you're feeling the urge to push. But pushing before your cervix is 10 centimeters or fully dilated can cause tearing or swelling of your cervix. Now, the panting technique, that'll help keep the pushing energy higher up in your chest rather than down low in your belly and vagina.
She doesn't need to push and tear. I paused it. I paused it. My fan is off. Whereas if she was fully dilated, 10 centimeters or more, then maybe the groaning, grunting, that would increase pressure, intra-abdominal pressure, as if she was pushing. Panting, that's what. Station to poop. Backward.
Is it okay if I check you again? Yeah. Pressure you're having could be caused by the baby's head rather than I feel like I have to throw up. I can feel it. I can feel it. The baby is coming. All right. 10 centimeters dilated. Dr. Kapansky, to labor room 11 for delivery.
Shoot. Yep, no pain. Look, we only got one wrong. You could download this and then do debriefing questions. I didn't name it. It was already named. It said the baby's name was Jude. Obviously, the baby became that. Hey, Jude. Okay. We've got the postpartum one next.